If you suffer from any type of pain, you know how debilitating it can be. But people are getting the pain relief they so desperately desire at QC Kinetix.
This morning we welcome Dr. Richard Schaefer, Medical Director of QC Kinetix, and Tyler Bell, the Director of Regenerative Medicine, to the show. Hello, gentlemen. Welcome to the show.
Thank you very much.
Thanks for having us.
What is the main goal of your practice?
I think the biggest thing that I try to instill into the practice is quality of life. Our big thing is not really about some pain scale that we lower for you. It's more about improving your functionality and enjoyment of life. That's really our goal.
We know that you guys offer stem cell therapy. What else do you guys offer at QC Kinetix?
We offer a wide variety of treatments, ranging anywhere from stem cell therapy, like you said, to A2M, to platelet-rich plasma, and a lot of regenerative cells that can go in and help regenerate tissue that's been damaged or broken down over time.
You mentioned A2M. What exactly is that?
A2M is something called alpha-2 macroglobulin, and it's a relatively recent addition to regenerative medicine practices, and it's a large protein molecule, and a lot of people don't know a whole lot about it, so we wanted to talk to you guys a little bit about it today. It's something specifically that works on decreasing some of the enzymes that can actually degrade a joint. So it's a really impressive molecule that we know about and are able to utilize.
So who is a candidate for A2M?
There's a lot of different candidates for A2M. A2M is really designed more for soft tissue breakdown, so a lot of our arthritic patients, so we get a lot of patients that come in, let's say with knee arthritis. That's the most common thing that we see and treat. Those patients specifically are great candidates for A2M therapy because we can try to go in and slow down that breakdown or stop the breakdown of the cartilage from progressing further.
Are there other areas of the body that you can treat using that?
Absolutely. You can use A2M in almost any joint, as Tyler was talking about. We certainly see knees the most, but certainly shoulders, wrists, ankles, the elbows. There's different places that we can use it. It's not really limited to a particular joint. It's more based on your particular condition.
Can I ask you about the results patients are seeing with this?
Oh, sure. Yeah.
Tell us about it.
Yes.
That's my favorite question that we get, and that's the reason we've grown so much. We now have 4 clinics, and our success rate, I always tell people, the proof is in the pudding. I love what we get to do because it's those quality of life metrics that you're working on with each patient when they come through the door. We have a very, very high success rate. Patients that come in develop a relationship. It's one-on-one. Everyone leaves with our cell phone and our email so that they can get a hold of us at any point. But the success rate has been through the roof at this point. So
they're able to go back to doing the things that they love to do, whether it's working out or playing tennis or golfing, things like that.
Absolutely. I think the biggest thing is that it's not an immediate fix. So Tyler and I have very detailed discussions during consultations explaining the proper expectations for that. So the things that we do are not overnight, and that we talk about the time frames and the proper expectations, and the more that we do that, the more that patients understand what we're doing and what to expect appropriately.
So what type of tools are you using to accomplish this goal?
So we do anything when we're talking about platelet-rich plasma or A2M. Those are blood components that we want to take and try to put cells in your body that are designed to be there in a higher abundance to allow your body to heal the way that it's supposed to. The same thing with a regenerative cell or a stem cell to go in and regrow tissue, and that's the beauty of what we get to do.
So tell us about your consultation process. What is that like?
Well, the consultation process is something that we really spend a lot of time on. So we'll spend anywhere from 30 minutes to an hour with somebody, depending on their case. Some people have a fairly focused case, some are more detailed, but we will take the time to educate everybody about what it is that we do, what they can expect from it, exactly how things are working, and then what they can expect on the back end in terms of results long term. So we like to spend time up front with people to make sure everybody understands exactly what they're doing.
Well, listen to this. QC Kinetix is offering Charlotte Today viewers a free 1-hour consultation. You'll get a thorough evaluation to determine if you're a good candidate for this treatment. Call 704-360-3057. 704-360-3057. You can also check out the website, qckinetix.com. Note the spelling of it there on your screen. Thank you so much for being here today. We sure do appreciate it.
Oh, indeed. Good
Thank
job.
you very much,
thank you very much for having us. We appreciate it.
Coming up next, baking for all those Halloween festivities is fun.